What guidance is available for combining migraine therapies safely? If you are dealing with migraines, you might wonder how to combine different therapies safely for the best results. Understanding how to mix treatments can be key to managing your symptoms effectively. Let's break down some important guidance on this topic. First, it is essential to know that migraine treatments fall into two main categories: acute therapies and preventive therapies. Acute therapies are used to stop a migraine once it starts, while preventive therapies are taken regularly to reduce the frequency and severity of attacks. Combining these therapies can enhance treatment effectiveness, especially if one medication does not provide enough relief. When considering combination therapies, start by prioritizing therapeutic independence. This means treating each condition separately whenever possible. Use medications that address both migraines and any other health issues without increasing risks. It is also wise to begin with single agents or monotherapy. This approach simplifies management and lowers the chances of side effects. However, keep in mind that about 40% of patients may not respond well to a single preventive agent. In those cases, combination preventive therapy may be necessary. When combining preventive medications, consider using drugs from different classes. For example, pairing beta blockers with anti-seizure medications can be effective. This strategy may allow for lower doses of each medication, which can help reduce side effects. Research has shown that combinations like propranolol and divalproex sodium can significantly decrease headache frequency in some patients. For acute treatments, combining medications that work through different pathways can provide better relief. For instance, triptans, which constrict blood vessels and block pain pathways, can be combined with non-steroidal anti-inflammatory drugs. This combination often leads to better outcomes than using either medication alone. Fixed-dose combinations, such as sumatriptan and naproxen or acetaminophen, aspirin and caffeine, are also available and effective. In emergency situations, intravenous combinations, including antiemetics and anti-inflammatory agents, are used for severe migraine attacks. Newer therapies are also on the horizon. Combining calcitonin gene-related peptide monoclonal antibodies, which are used for prevention, with gepants, which are used acutely, appears to be safe and well tolerated. These therapies target different aspects of migraine biology, potentially offering enhanced benefits without serious side effects. However, safety is paramount. Always check for contraindications, especially cardiovascular risks, before using vasoconstrictive agents like triptans. Monitor for side effects and drug interactions, particularly when combining multiple preventive medications. Avoid using two calcitonin gene-related peptide antagonists at the same time due to potential unknown effects on normal body functions. Adjust or discontinue treatments based on how well they work and how well you tolerate them. In practice, start with monotherapy and consider combination therapy if necessary, always under medical supervision. Using combination acute treatments early in an attack can improve pain control. Remember to take into account individual factors, such as other health conditions, and how well you tolerate medications when selecting combinations. Regular follow-up appointments are important to evaluate how well the treatments are working and to ensure safety. Combining migraine therapies safely requires a thoughtful approach that balances improved effectiveness with careful monitoring for side effects. By using medications that work well together and avoiding overlapping risks, you can find a treatment plan that works best for you.